Hello everyone, and thank you for the kind invitation. So I'm representing here the Neonatal Data Analysis Unit from Imperial College, London, and this is led by Professor Nina Modi, who sends her apologies, she can't be here today. And we really want to thank you, Paula, and her team, because we've really enjoyed being part of the Alliance, and we have really benefited. And I hope this talk will illustrate how we benefited in this way. So the National Neonatal Research Database contains data from all neonatal admissions across the NHS. It's very unique worldwide and contains one of the largest cohorts. And I'll tell you a bit more about that. And we really benefit from the Alliance because we've also had streamlined our data access requirements. Oh, sorry. Oh. Yeah, I'm still on that slide. So we streamlined the data access requirements, and we've also really benefited from help from HDR UK to communicate our outputs as well. So this is one of the outputs. We really want to thank the HDR UK team, because before we were part of the Alliance, perhaps we haven't really focused on how we communicate our many outputs over the last 14 years since the NNRD has been formed. And this is an illustration, an example of an infographic which HDR UK helped us to produce. So the National Neonatal Research Database contains all admissions from England, Wales, and Scotland, and sick and preterm babies are admitted into NHS hospitals. So we have a really unique population-based data set, which is really unique worldwide. To date, we have over 1 million babies in our data set with a really rich data source, which is used not just by our own research team, but by those externally as well, nationally and internationally. And you can see some of the outputs here which have really influenced clinical care. I want to highlight just a few. So one is a study which showed that there was reduced mortality and severe brain injury among preterm babies born in specialized hospitals. We also showed that there was a north-south divide in England in terms of mortality rates among preterm babies. And this really influenced how we can organize our services to benefit our patients. And a study I led showed that in babies who are born preterm, giving their mum's milk very early reduces their risk of necrotizing enterocolitis, which is this very fatal inflammatory disease of the bowel. We are now also using the NNRD in clinical trials. So there's lots of ongoing work to build on that. And hearing from the talks today, that's clearly an area we all need to focus on. So how did we ensure interoperability and usability? This is the focus of this talk today. And the answer really is collaboration and trust among our users, the clinicians that enter the data, but also the parents and those adults born preterm who are also in our PPIE groups. This creation of the NNRD is really a testament to the neonatal community in this country, because 14 years ago we got together and thought we need to bring our data together. Our babies, majority of them are moving around different hospitals. Near half of our preterm babies have to be transferred. So how are we going to bring these data together? And 14 years later, we have one of the biggest cohorts in the world. So I just want to remind us about the scale of the actual data sets. You can see here there are near 200 neonatal units across the country submitting data. These are busy clinicians. I'm a consultant neonatologist myself. We look after some of the sickest and smallest babies in the country. And we are short-staffed as everyone else is in the country. And we're busy entering data. We need to value those that enter data. We need to feed it back to them. They need to know what an impact they're making. So we're working with trainees. We're working with the BAPM, British Association of Perinatal Medicine, to really highlight the importance of data. And so trainees understand that they are contributing to research on a daily basis. Those nurses entering daily data, they know they're not just entering numbers. They are actually contributing to improving outcomes for the future. And parents also are part of our steering group so that they can shape the landscape of these data. So these data, just like any routine data, are a bit messy because they're busy clinicians. Hand on heart, may not have entered all the complete data at times when you're really busy on a shift. How do we bring that slightly messy data together into a single data repository in the NNRD? So So in 2014, we achieved this by having an Information Standards Board approved neonatal dataset, one of the first in the country. And what this dataset does is it ensures consistency in the data extracted from the EPR systems. And this ensures that it is vendor agnostic. It doesn't matter which EPR system you're using. You'll have the same data in the same format put together into a single repository. This then comes to us in the Imperial College London, where we ensure the standardization of the structure. So there's 3 types of structure really in the NNRD. One is the static once-only data items, such as gestation, birth weight, and one is episodic data. So that's the care in one single hospital. Many of our babies are transferred, as I said before, so they will have many episodes of care. And we can tell when they get transferred. And then the other data structure is daily data, and you can imagine how rich our data set. We have daily medications, we've got daily ventilation. This is really unknown in other parts of the world. So we have real interest from international collaborators, and the Alliance has really helped our discoverability and our accessibility, and we now have this common platform in the gateway for those researchers to come and ask us about our data. So we've really benefited from that and have really quite a lot of more inquiries since we've joined up with HDR UK. And then we can, analyze these data because it's in a structured format and disseminate the knowledge that we learn from it. Again, with the help of HDR UK, you can see that hopefully we're reaching out to the public in an even better way. Usability. So I've talked to you about how we can have this common information standards neonatal data set, but there are other aspects we need to think about for increasing our usability. Importantly, there was mention about quality. That's really important. Garbage in, garbage out. How do we ensure trust that our data are of high quality? So we've actually built a very strong relationship with our clinicians on the front line. As I said, we collaborated many years ago, and we have a feedback loop. So we communicate to the trusts and the clinicians so that they can check their data, and then there's a feedback loop. So we receive data every quarter of the year, so there's a regular communications with those neonatal units, and we send regular newsletters out as well so that they know what studies are being undertaken. We also have a multi-professional steering board. This is really important. We need to build that trust that has been mentioned so many times today. So that steering board includes parents, includes adults born preterm, it includes those clinicians, it includes the professional bodies, the British Association of Perinatal Medicine, and together we need to really decide how we're going to use this data collectively. And we need buy-in from those on the ground entering the data too. So it's really important, and they have a say in those data requests coming in, whether or not we're going to approve them. So that's been really important in this journey. And clearly the CAG and REC approvals have been really important, and we've got Caldecott Garden approvals from each trust. And as you can see, this is a part of the success story of these multiple outputs you can see, which ranges from health services research to actually influencing health policy as well. And I just wanted here to share that really hot off the press, we've had a refresh of our neonatal dataset. It was first published in 2014. This is just a few weeks ago. There was a slight delay from COVID, but I just wanted to thank the NHS data model and dictionary service, which really have worked tirelessly to help us with the neonatal community to refresh this dataset, because actually neonatal care have moved on in the last few years. And delighted, I think our outcomes are better, but our dataset needs to reflect that contemporary neonatal care. And so it's an ongoing partnership with NHS Digital. So in summary, just to finish off that section, to ensure interoperability and usability, I've talked about how we need to standardize the data when we curate it. This needs to be informed by an information standard, and ours contains over 400 data items, and we need to ensure that these data are quality assured by actually working with the community. And really important, as I've said many times, is building that trust and that collaboration. So I'm just going to finish off with telling you a bit more about the ongoing developments, just really quickly. So we're developing an NNRD AI. In fact, that's almost in completion, and we hope to apply more machine learning applications to it. We're developing the NNRD digital twin, which will have synthetic data and making it more accessible. Mother and Baby Data Hub, led by Nina. And I'm leading the NNRD preterm, funded by the NIHR, part by fellowship, to create one of the world's largest birth cohorts for preterm babies, linking health and non-health data sets. And you can visit this website, neowonder.org.uk, if you want to find more information. But essentially, really importantly, we've heard today about linking health and non-health education data sets, for example. So a real gap in our knowledge is, although our care for our preterm babies has improved, such as survival has increased, we have no data from the last 14 years to tell our parents how have these children been doing as they grow up. And for me as a clinician looking after these very sick babies, I feel that is really irresponsible, actually. We need to do better. And I'm working with many parents in my group to ensure this happens. And this is my fellowship for the next couple of years. So we're going to link the NNRD to the National Pupil Database to gain that education data. But we're also going to link it to other health data sets, the Cell Data Bank in Wales, which is a very rich data set, and also hopefully some environmental data as well. Quite ambitious, but hopefully I'll have some success in that. So I just want to finish off to acknowledge those on our steering group, but importantly, I want to leave you with this quote from Sophie, a mother of 2 preterm babies, which really illustrates the altruism of many of our parents. They want these data to be used. They want their experiences to benefit other parents and their families and their babies. So I'm going to leave you that quote. Thank you very much for listening.